how does GHK copper compare to other anti-aging treatments? So what if the best anti-aging molecule on Earth has been hiding in your blood this whole time? There is a molecule in your blood that at age 20 circulates at 200 nanograms per milliliter. It repairs tissue, it remodels collagen, it modulates the expression of over 4,000 human genes, it controls wound healing, cognitive repair, and immune function. And by the time you're 60, its levels have dropped to roughly 80 nanograms per milliliter. The molecule is GHK copper. It's a tripeptide, and the decline of it in your body is not just a cosmetic problem. It might be the most under-recognized aging biometrics of all of medicine. So I'm Regan Archibald, founder of Ageless Future, the world leader in longevity medicine. We host these cool age reversal events in Utah. I'd love to have you there. Just go to agelessfuture.com, hit the events page, and apply. See if you qualify to come. Okay, so let's talk about GHK copper versus everything else you've been told that works for aging skin. Retinol, Botox, vitamin C, fillers. Let's just go head to head, because retinol, what it can do is it irritates things. Botox paralyzes things. Fillers dissolve over time. They overstuff you and then it dissolves. None of them repair. I wanted to see what it was like to have Botox because so many of my friends and people in my office doing it. So I did a little bit in my forehead and I could not wait for that stuff to wear out. I just felt kind of like sleepy all day. And you know, it's hard to read people's body language when there's not a lot of expression in the face. So, but these things, they don't repair. There's no anti-aging benefit. They operate mostly on this principle of symptom management, which is one of the things that the Western medical complex does, is just manage symptoms. Retinol, it does accelerate cell turnover because it causes irritation, photosensitivity, and requires months before any visible result with no structural repair happening underneath it. If you think of Botox, it's paralyzing. It's toxin, literally. It's a toxin for your nerves. It paralyzes the muscles that cause expression lines, and it does nothing to the dermis itself. Fillers add temporary volume, but once again, it's going to dissolve in 6 to 18 months, and it requires repeat visits that are not fun. Vitamin C is a potent antioxidant, but it doesn't rebuild oxygen, or it doesn't rebuild collagen structure. It just assists in the synthesis, but it's not the driver of it. So here's what these treatments don't do. They do not reprogram gene expression of the aged tissue back towards your younger self. They treat the symptom. GHK copper, it goes deeper. Now, here's the interesting thing. So McGill's clinical study, this was led by Dr. Wayne Carey, and yes, it's 21 subjects, 3 months of GHK copper on the protocol. They produced a 28% average increase in subdermal collagen density. Now, this is the most important part of the skin that we all see. In the top group, they had a 51% improvement. Now, I don't know the difference between what were the top performers, the responders that had a 51% improvement doing. I would guess they're eating better, they're exercising more, they're doing some sauna, some red light therapy, all the things that are great for the skin. They're getting out in the sun as the sun's rising in the morning with no sunscreen on, and as the sun's setting. Those are great for the architecture of your skin. And when you think of new collagen being synthesized and deposited in the dermis, now you compare that to the gold standard in retinol literature. So let's just compare it and see how they did. The best trials with retinol showed an 8 to 16% improvement in fine lines over 24 weeks, with results largely plateauing after that. Botox fillers, 3 to 4 months, and then they gotta be repeated. Fillers, 16 to 18 months. But GHK copper, or GHK-Cu, copper is that Cu, it rebuilds, and the data is just beginning. I mean, this landmark paper published in Biomed Research in 2015, what they analyzed is GHK's effect on human gene expression. The findings were extraordinary. GHK-Cu modulates 31.2% of human genes and affects over 4,000 individual genes, including those governing inflammation, DNA repair, antioxidant defense, stem cell activation, and collagen remodeling. That stem cell activation is really important because one of the studies done in Korea, they injected stem cells into the knees of patients who had osteoarthritis. And then they wanted to find out, well, if we added GHK copper, is that going to selectively cause the stem cells to preferentially rebuild this structure called the cartilage? And what they found, because the collagen in your skin and the collagen that's required for the integrity of your joints, for your ligaments, your tendons, they found that actually GHK copper helped increase the stem cell selectivity. So one of the things that we do in our office is we do facelifts with stem cells. We'll do microneedling of stem cells and exosomes, and then you have GHK copper that you apply, and we've seen people look younger and younger. In some cases, they look 10, 15 years younger. And yes, that's me subjectively looking at it, but if you look at the research and you actually start seeing these dermal lines, you'll see that they have literally reversed their age. They've taken a decade off their face in less than a few days. And so what GHK copper does is it reverses the gene expression that is the signature of aged tissue back towards the expression of patterns observed in younger tissues. This is not masking it, it's literally reversing your molecular fingerprint. So I know you love the way your face looks. I mean, if you think about how many of us, the selfies we take, the pictures we take when we're on random trips or when we're just in day-to-day life, we want our face to look the best. We want to put our best foot forward, but actually we want to put our best face forward. And so if you think about GHK copper, just think of this as the regenerative alpha. It supersedes any topical cream. There's no neurotoxin injections. It's not like an antioxidant serum, but it's really helping you reverse not only the outer layer of this aging, but if you think about, that problem when we've tested the plasma levels, how quickly our GHK copper declines from age 20 to age 60. Now you're seeing, okay, well, maybe doing some GHK copper, something internally, and now as an injectable, now we're going to get somewhere because now you're creating this better free flow of GHK copper because you go from 200 nanograms per milliliter at age 20, then you're at 80 nanograms per milliliter by age 60. That drop is what's aging you. And here's the mistake that makes this very interesting is most people don't ever try to replenish the GHK copper internally. And when you have a 60% reduction in circulating levels, if you're 60 years old, many of us are pushing that, we're getting there. Well, what happens is when you replenish the circulating levels of not just GHK copper, but BPC, KPV, you get your thymosin alpha 1, you prime your immune system, what you're going to see is that you're going to get better tissue repair, better immune modulation, better nerve regeneration, better cognitive maintenance. And if you've done any kind of regenerative medicine, you're going to notice your joints feel better. You have less inflammation. GHK copper, we love stacking it with KPV, BPC 157, and thymosin beta 4 or TB500 because our goal is to restore your physiological signaling because all peptides is signaling medicine. It's restoring the environment in your body by reducing inflammation so you get better signals. And instead of just trying to mask a symptom or override what's happened, you just reprogram your body. It's like updating your operating system. And the very first place that you want to start is get your blood labs done and run it through a functional medicine provider. All of us are trained in functional medicine at Ageless Future. You go to agelessfuture.com. We're going to look at your inflammatory markers. We're going to look at fibrinogen, which is a very important marker for vascular and neurological inflammation. We're also going to look at your IGF-1. This is one of your downstream proxies for growth hormone signaling and true anabolism. We're also going to look at your homocysteine, see if your brain's got some inflammation in it. Maybe after watching this video, it is all inflamed. But the best place to get started, go to agelessfuture.com. Talk to my team. It's a free intro call. They'll help you get your labs ran, or if you have them ran, then meet with my team. They'll go through it with you. For those of you who want to go even deeper, and if you want to know what does GHK copper do, I'll give you insights into this powerhouse peptide in minutes. Just click on that video. I'll see you there.